So basically, Margaret, you're here today. How many weeks after I did your surgery on your right heel?
It, you did surgery October 3rd, so it's been about 4 or 5 weeks.
Okay, yeah, about 5 weeks today,
Yep.
right? And so you had a very interesting case because you had a case of severe plantar fasciitis, which is, you had severe heel pain and you had a lot of swelling. And when I met you, you couldn't even put your foot on the ground, right?
No, I couldn't.
And I know that you went to another podiatrist and you've tried non-surgical approach and
I tried everything.
everything, right? And after trying and not getting anywhere with the other physician, you decided to come to me to have your problem fixed, right?
Yes.
And the reason why I'm doing this testimony is because, when I met you, I was like, okay, we're going to do the new surgery, but that 5% of people who don't improve are usually the ones that have it that bad, and then we have to go and cut the tendon. So, well, you're sitting here, 5 weeks after the surgery, and you're smiling, right?
Yeah, I'm smiling, not crying.
So, how much better are you comparison to when we met?
When I couldn't even walk in, I had such a hard time.
Right.
And it's like, now, I feel like I can run, but not yet.
Not
I know
yet.
I can.
You remember how I told you it really takes 6 weeks?
Yeah.
So you.
But I've come a long way.
Right, right. So just take it easy, don't overdo it. You're gonna have some good days and bad days, as I told you.
Mm-hmm.
The key is now you know what to do.
Right.
So you learned your lesson. And basically continue the stretching, finish off the physical therapy, wear your orthotics.
Right.
But so I have a $1 million question. So if you would have to do it again, would you do it?
Oh, I'd be right here doing it all over the same way.
Probably not wait as long, right?
No, I would not wait as long as I did. I just thought the other doctor was doing what he was supposed to do, but I just couldn't deal with the pain anymore.
Right. No, I'm with you. And remember how I told you with the old surgery we used to wait much longer because we didn't really want to cut the tendon. With the new surgery, because
it was fabulous.
Well, but because we don't cut the tendon, we're definitely like, okay, if nothing works, plan B, right? Because you have nothing to lose. It never makes it worse, right?
Well, even after the surgery, the same day, I wasn't in as much pain as I was when I didn't have it.
Right.
There was less pain that day.
Well, remember you had that amniox injection, right?
Yes.
And that's what kind of makes a huge difference. So, because we did it before amniox was available, and it took much longer, and the results were not as good. So I think it's basically a combination of Tenex, which is a new surgery, and then that amniox injection that does such a huge
Well, I'd
difference.
suggest this to anybody.
Yeah, I mean, I'm in love with this procedure. I can
So
tell you.
am I.
Yes, because I've practiced for 19 years, and the first 15 years of my practice, we had to go and cut it. So can you imagine when this new surgery came out? I'm like, sign me up. I'm gonna fly.
Sign me up.
Yes.
I'm glad I got it because that was the best thing that you
Well,
done.
thank you for being compliant and being a nice patient.
Thank you.